Good morning, ladies and gentlemen. I'd like to thank the organisers for inviting me to speak here today firstly, and I'd also like to thank my co-authors on this paper, Emer Kennedy and Christine Cummins, who completed their PhD in Moorepark, and also John Paul Murphy, our farm manager. So firstly, just to briefly outline what we'll talk about today. So we'll look at what's actually happening on some Irish dairy farms. We would then go through some calving management practices and then move on to colostrum management and look at it in terms of colostrum quality, the timing of feeding colostrum, the quantity of colostrum to feed, and then move on to some transition milk feeding. So we can all ask ourselves this question: why is heifer rearing important? Well, as we've already heard today, heifers obviously form the building blocks of our future dairy herd, but they are also quite a substantial cost on the overall enterprise. When we look at the total cost of rearing one replacement heifer, it's over €1,500. Now, if we were to scale that up to a herd size, with say 100 cows and a 20% replacement rate, this means that there's over €30,000 tied up with our replacement heifers every year on a dairy farm. So I think in anybody's language, this is quite a substantial amount of money. And again, it emphasises the point that we really need to focus on the way that we're rearing the heifers and make sure that we're getting a return for our investment. Now, perhaps somewhat startling is a figure that has recently come out in a published paper where data from Herd Plus has been looked at from 2006 to 2012. And what it shows is that almost 25%, so that's almost 1/4 of heifers, that's dairy heifers, that are born in the country don't even have a calf. So again, this reiterates the point of how important it is to actually rear the heifers to the best of our ability and make sure that they are viable and actually have a calf. So just quickly to have a look at some dry cow management on Irish dairy farms. And this is part of a survey that Christine completed recently. Some of you may haven't even been part of it, and we'd like to thank you for your cooperation. So Christine surveyed over 260 farmers, and they were representative of the national dairy population, and they stretched all across the country. What we found was that about 80% of farmers are using a dry period length of about 8 to 12 weeks. Now, it should be noted, particularly this year when quotas have gone and farmers are tempted to milk on that little bit, that a shorter dry period will result in poorer quality colostrum. So just bear that in mind if you are milking the cows on a little bit longer this year. The majority of farmers are targeting a condition score of 3 to 3.5 to calve their cows in, and when it comes to feeding the cows over the winter, over 50% are feeding grass silage only, and about 40% are feeding grass silage and concentrate. But again, the winter diet is dependent on the cow condition score. In terms of dry cow mineral feeding, over 50% are feeding dry cow minerals for 6 to 8 weeks, and 70% are giving them in the powdered format, like you can see here in the picture. So when we're managing our cows at calving, our main objective is to deliver a live and viable calf, and also to make sure that the cow makes a smooth transition into the milking herd. However, there are two main problems that we can encounter. The first is calving difficulty. This may be because the cows aren't in the correct condition, they're not at the correct weight, genetics, maybe it's a hard calving sire, and also the animals may be stressed. Also calf mortality. This can be before, during, or within 48 hours of birth. So just briefly to look at some of the do's and don'ts of newborn calf management. Pre-calving, the do's. You should move calves to the calving pens pre-calving about 3 days before they're due to calve. During calving, all the beds should be straw bedded and ideally have individual maternity pens for your cows. They should be monitored every 3 to 6 hours once calving has commenced, and if after the head and feet are showing there's no progress after 2 hours, intervention may be required. Post-calving, calves should be assessed for signs of life and resuscitate if necessary. Now, this is quite an interesting point because also some data from another ongoing experiment in Moorepark, where dead calves are submitted for post-mortem, would show that a lot of calves that come in actually did take a breath in that their lungs were inflated, but the farmer perceived them to be dead, so didn't try and do anything about saving them. So always, even if you think that calf is dead, try resuscitate it and give it a go. You never know, you might save another life. And the last point there is about disinfecting the navel. So if you are currently dipping or spraying iodine on navels, continue to do so. The don'ts: don't start moving cows when they've started calving, as this will stress them out and can lead to increased calving difficulty. Again, during calving, don't unnecessarily disturb the cows during calving. Don't overcrowd the maternity pen. And I guess this is something for guys who are expanding to consider. Don't tether heifers unless it's to assist them. Post-calving, don't prematurely cut the umbilical cord. Don't assume that a weak calf will suck or drink. And don't leave the calf with the dam. So if we look at these are the correct management practices that we've just gone through, but what's actually happening out in farms? So almost 50% of farmers are using shared calving pens. Again, the larger farms tended to use shared calving pens compared to smaller farms. And 37% of all those surveyed were using individual calving pens. The majority are moving cows to the maternity pens within 24 hours of calving. Once the cows have started calving, they're again checking the cows every 6 hours, but less frequently at night. And over 50% of farmers are waiting 2 to 4 hours before assisting. So as you can see, our calving management practices aren't really too bad out in farm. Of course, it goes without saying, hygiene is of a great importance, be it in the calving pens or the calf pens. When it comes to the calving pens, we want to make sure that that calf is being born into a nice clean environment. So this means that the calving pens need to be regularly and thoroughly cleaned out and bedded again with a nice bed of clean straw. In the calf pens, you can do a quick and simple easy test. So you can see here we have the knee test. So the bed might look nice and dry with nice fluffy clean straw, but if you were to actually kneel down into it with your knee and come up, and if you find a little wet patch on your knee, that means that the calf is actually lying on a very damp surface. And given that the calves spend the majority of their day lying down, this isn't an ideal scenario. It's also extremely important to clean the calf pens thoroughly and regularly, and this goes for the equipment as well. In Christine's survey, she also found that rates of morbidity and mortality are reduced when farmers, practice good hygiene and clean the calving pens, the calf pens, and the feeding equipment thoroughly. When it comes to caring for sick calves, ideally have a separate area for your sick calves. As you're going through them, identify them early, isolate them early, and ideally don't return them to the healthy group. It's also good practice to feed these calves last, because you can give them that extra time, care, and attention, but it also means that your clothes aren't contaminated when you're going back to the healthy calves. So if possible, even have a separate waterproof clothes there just for dealing with the sick calves, so that you can then clean it or take it off before you deal with your healthy calves and you don't spread infection. Okay, so we'll move on to some colostrum management. And to me, this is quite a startling and interesting result that's coming from the All-Ireland Disease Survey reports. And what it's showing is that of all the calves submitted for, because they were sick or for post-mortem, that almost 70% of those calves had inadequate absorption of immunoglobulins or antibodies. So essentially, this is down to colostrum management. So the three key factors for achieving adequate passive transfer are the quality of the colostrum, the timing of the feeding, and also the volume of colostrum that's fed to the calf. So if we just go into colostrum a little bit more in depthly, and we say, what is colostrum? Well, it is the first milk produced by the cow after she calves. It contains many important substances that are important for calf health, such as energy, vitamins and minerals, growth factors, and the all-important immunoglobulins or antibodies. So when we talk about the immunoglobulins, immunoglobulin G is the most prevalent one, and it is the most important immunoglobulin. And colostrum quality is generally determined by the amount of immunoglobulin G that it contains. And the cutoff point is about 50 milligrams per mil. So why is colostrum important? Well, unlike human babies, there's no transfer of immunoglobulins between the cow and the calf when the calf is in utero. So the placenta separates the maternal and fetal blood supplies, and the calf is almost entirely dependent on the absorption of maternal immunoglobulins from the colostrum. So this is why feeding colostrum is so important for the calf. Now, the majority of studies that you would see on colostrum quality come from countries where they have cows that produce a lot more milk than our cows. So in Moorepark, we set about determining the quality of colostrum of Irish dairy cows, and we looked at 704 cows. Now, this is the range of the IgG within the colostrum, and what you can see is that there's quite a large range. In fact, it goes from 13 to 256. And this is somewhat similar to a range that you would see in any herd. You know, a lot of farmers ask, is there a lot of variation in cows within a herd? And the simple answer is yes, there is. But what you can immediately see is that the mean of our colostrum was 112 grams per litre. So what we're saying is that over 95% of the samples that we tested were above that threshold of 50 grams per litre. So basically, because our cows are producing less milk, there's less dilution of the antibodies, so our colostrum quality tends to be higher than say, big, milky, Holstein type cows that you'd find in the US. Now, this is a very important graph, and it struck me when we went around the country doing lots of different roadshows that farmers didn't actually realise that colostrum is only the first milking. Milkings 2 to 6 are actually called transition milk. So colostrum, the first milking, is only suitable for feeding to the calf as their first feed. So as you can see here, there is an over 50% reduction in the amount of IgG between the first and second milking. And if we put in our threshold line of 50 milligrams per mil, what you can see is that second milking doesn't even come up to that threshold. So again, indicating that that second milking is not of high enough quality to feed to the calf as her first feed. So when we examined the data further and we looked at the factors that are affecting colostrum quality, one of the factors we found was parity. Now, a lot of old advice would have said that you should throw out the colostrum of heifers because the quality is poor. And yes, you can see here that the younger animals, so the first and second parity animals, do have lower quality colostrum compared to the third, fourth, fifth parity cows. But what you can also see is that the threshold here of 50, they're all well above it. You know, so I wouldn't adhere to any of that previous advice of discarding heifer colostrum. When we look at time interval, now this is quite an important one, say in the systems that we operate here. Once the cow is over 9 hours from calving, the colostrum quality reduces. And essentially that's just an effect because the cow is bagging up, she's producing more milk and it's diluting down the antibodies. And this is something to be mindful of, especially, you know, if cows are calving at night time. So for example, if a cow calved at 8 o'clock in the night and you're not going to milk her again until the next morning, the chances are that her colostrum is of much poorer quality than a cow that, say, calves at 5 o'clock in the morning. Month of calving is also a factor which affects colostrum quality. And you can see here that cows that calve in the April-May period, their colostrum quality is a lot lower than cows that calved earlier in the spring season. And there are many reasons that we hypothesized for this. Some of them could be that the cow has a very long dry period if she's only calving in April or May. Also, she's been on grass silage for a long period of time, and that is a much more inferior quality feed than grass. But also, if you think about it, if those cows are the last ones calving, there was obviously some sort of problem with them. So there might be some underlying subclinical reason for this that's also been reflected in the poorer quality colostrum. And incidentally, you can see the last two columns here are autumn calving cows, and their colostrum quality is also very high, again probably because they're coming off a grass-based diet. So weighted colostrum or volume. So the amount of colostrum that a cow produces also affects it. So essentially your higher yielding cows tend to produce a lower quality colostrum. Again, it's down to a dilution effect. Now there's a very simple way. So like obviously we can control when we're going to feed it and how much we're going to feed it. One of the big unknowns out in farm is what quality is is colostrum actually that we have. So there's a very simple way of testing it, and it's by using a refractometer. So you can just place a few drops of the colostrum onto the refractometer, look through the eyepiece, and then this is what you'll see when you look through the eyepiece. So what we're looking for is values greater than 22%, and that represents high quality colostrum or colostrum that's suitable to feed to the calves for their first feed. If it doesn't get up to this mark, you should really be holding it for seconds feeding and not using it for the first feed for the calf. A lot of people tend to store colostrum, and if storing colostrum, it should be collected and stored in clean containers. Like you can see here in a milk carton or in a bag if it's to be frozen. But the key thing when storing colostrum is that it should be stored really early. So you need to be storing it within 6 hours of collecting it, because the bacterial growth is the highest within those first 6 hours. Once you've stored the colostrum and collected it correctly, it will last for at least 2 days in the fridge, or you can freeze it and it will easily last for a year in the freezer. So this is just some results from an experiment we did as part of Christine's PhD about 2 years ago, where we looked at 5 different ways of essentially treating or storing the colostrum. We pasteurised some colostrum, again to reduce the bacteria in it. We fed some fresh. We stored in the green there colostrum for 2 days at 4 degrees, so essentially stored it in a fridge. Then the other 2 treatments were storing colostrum at 13 degrees or 22 degrees, so somewhat simulating colostrum being stored at room temperature. And what you immediately notice is that here in these blue and red lines is that the absorption of the antibodies by the calves is much reduced, because there's a lot more bacteria in those samples. So basically what's happening is the bacteria is binding to the antibodies and the calves can't actually absorb it. So you might think you're doing a fantastic job by keeping this colostrum on hand ready to feed to the calves, but actually it's not doing the job that you think it's doing. So it's really important that if you're storing colostrum, you do it correctly. So if we look at colostrum management on Irish farms and say, well, what's actually happening? The majority of farmers are collecting their colostrum within 2 hours. 85% are storing it. And worryingly, some people are storing it at room temperature for up to a week. 60% are feeding dam's colostrum to the calf, which is obviously gold standard practice, and 50% are feeding the calves within 3 hours. However, this is because the majority are leaving the calf with the cow and leaving the calf to its own devices. You can see with a big red X through this, this is not an advisable practice, because for one, you don't know how much colostrum the calf is actually drinking. You don't know how soon the calf is drinking that colostrum. And also when it comes to diseases such as Iones, the calves should really be removed as soon as possible after birth. In terms of transition milk feeding, about 2/3 of farmers are feeding transition milk for up to 3 days. So I guess we should ask the question then, how soon should colostrum be fed? Well, this graph tells that story. So you can see that within the first 2 hours after birth, absorption of colostrum is maximised. And as we go to 6 hours after birth, which some farmers think that, feeding the calf within 6 hours is great, but what you can actually see is that the calf's ability to absorb the immunoglobulins has more than dropped by half by the time it's 6 hours old. And then by the time the calf gets to 24 hours old, it can no longer absorb any more antibodies from the colostrum. So how much colostrum does the calf actually need? Well, previous recommendations have all been based on quantity, and it's to feed 3 litres within 2 hours of birth, or at least 2 litres within 4 hours, and a total of 4 litres within 12 hours from birth. However, in Ireland we have many different calves of different shapes and sizes, so we get big Friesians, small Friesians, big Jerseys, small Jerseys. So from an experiment that we completed a number of years ago, we found that the ideal is feeding the calves 8.5% of their birth body weight. So roughly our calves are more or less born at 35 kilos, so that's 3 litres for a 35 kilo calf. How should you feed the colostrum? This is a frequently asked question. Stomach tube, it's nice and quick. In fact, I timed our farm manager there recently when he was stomach tubing a calf, and from the time he put the tube into the calf's throat to when he removed it, it took 1.5 minutes. Now, if anybody tells me they don't have 1.5 minutes to spare to feed a calf, I don't really believe it. The colostrum, when you stomach tube, yes, it does go into the forestomach, but it flows to the abomasum and the small intestine within 3 hours, so there's no problem. I guess the really good thing about stomach tubing is that it's fast, and you know that the calf has gotten the required amount of colostrum within the time frame. You can also use a bottle and teat. It is much slower than a stomach tube. There are slightly higher antibody absorption with it. A lot of people don't like to use a stomach tube because they haven't really used it before. But if the vet is in the yard, or if there's a neighbour who's quite good at using it, get them to show you how to use it. If you do want to use the bottle and teat, what I would say is that try and get the calves fed within the first half hour of being born, because they're much more likely to suck then, and the drive tends to go off them after that. As we saw from our survey, a lot of farmers think that a suitable way of feeding colostrum is by leaving the calf with the cow. But as we know, this leads to an increased risk of failure of passive transfer, because we're unsure how much the calf has drunk, and we're also unsure how soon they got the colostrum. And again, it doesn't work in with our practice of removing the calf from the cow straight away, particularly in nighty ewnies. So just to recap, the very simple AHI rule of for dealing with your colostrum management is colostrum 1, 2, 3. So it's the first milking only, to feed within 2 hours of birth, and to feed 3 litres. I guess the next question is transition milk feeding necessary? Within an experiment that we carried out again at Moorepark, we found that 4 transition milk feeds were less likely to show signs indicating compromised health. In other words, we found that the cows had less chance of runny eyes or droopy ears when we fed transition milk. So there's local effects going on for the calf when you feed the transition milk. However, for a lot of farmers, ewnies is an issue. An experiment we conducted this year, earlier this spring, we looked at feeding colostrum and then going straight onto milk replacer. So if there is a ewnies disease issue, calves can be fed their milk replacer once the colostrum 1, 2, 3 rule is implemented. And that is critically important, that you have to ensure that the calves get sufficient colostrum within the right time frame. So if you just look at the graph there, what you'll see is that in the black bars, we have calves that were fed colostrum, 4 feeds of transition milk, and then they went on to a 26% crude protein milk replacer, and we compared them to calves in the yellow that were fed their colostrum and then went straight on to the 26% crude protein milk replacer. And you can see that there's no difference in terms of weight for those calves at weaning, 140 or 240 days old. So in conclusion, what we would like is for the cows to be moved to maternity pens at least 3 days before calving. They should be monitored closely once calving has commenced. And obviously it goes without saying that hygiene is of paramount importance. Colostrum quality, we need to ensure that we have very high colostrum quality, which we can check with a refractometer. And if storing colostrum, it should be stored within 6 hours of collection. Adhere to the colostrum 1, 2, 3 rule, so that's the first milking within 2 hours of birth and to feed 3 litres. If there is a ewnies disease issue, you can feed milk replacers straight after feeding colostrum, again once you adhere to the rule, but otherwise transition milk should be fed. So I'd like to thank you all for your attention, and I'd like to wish you all a very successful 2016 calving season. Thanks.